So hello and welcome to my YouTube channel. My name is Mwangi. Today we'll be speaking about PPEs for chemotherapy administration, or what I normally feel comfortable using according to my hospital policy. So there are 3 essential items that I always must have if I'm giving chemotherapy and I'm at the bedside and monitoring chemotherapy infusions all day. And these are a pair of nitrile gloves such as this. Then I usually have a hairnet like this, or a cap, whichever you prefer. Then I have a mask, and this is just the usual surgical masks. And then I have an impervious enhanced gown. So this is a gown that is long sleeved and is adequate and ideal for chemotherapy administration. Impervious means water cannot get through to the other side from this side, so I am protected from this side. So one by one, these items are essential to ensure one is completely safe while handling chemotherapy and they're not exposed unnecessarily. Because my chemo comes prepared by the oncology pharmacist, I don't feel like there is a lot of exposure in the air, because therefore I may not even need any other mask other than the usual mask that we're using because of COVID-19, and that is a normal surgical mask. This is because my hospital has a policy where chemo has to be prepared, and before preparation for chemotherapy, all the tubings must be primed with saline before the medication can be put in the bag or in the bottle. Meaning, when the chemo is coming to you, the tubings are already primed. There is no air bubbles in the tubings, so there is nothing you need to expel into the atmosphere before you put the chemo, or you connect the chemo infusion into the patient's hand or the patient's IV access. So yes, therefore I feel completely safe wearing a normal surgical mask. However, sometimes you will find me in an N95 mask, especially if the agents we are giving is not really the normal chemotherapy that we use, is other items or other agents. For example, for maybe for clients with cancer of the bladder, you might find them having BCG given intravesicularly, and this means it's a live attenuated bacteria, and therefore I have to have an N95. So that is the only time I have to have an N95 while giving chemotherapy. However, if I have many clients who are receiving chemotherapy, I feel safer having this coupled together with an N95, just for extra measure of safety, so that I am not exposed at whatever level, because I cannot just afford to be exposed to it while knowing, because this will take a toll on my health, and I have a young child who is still nursing, and therefore I want to remain as safe as possible. So yes, this is about how to don each of these items, and I will start with the hairnet, and it comes like this. What I usually do before I put my hairnet on, I try to minimize the volume of the hair, and I will take these extensions and wrap them around into like a messy bun. And let me move a little bit behind, and therefore this messy bun will be able to at least lessen the bulkiness of the hair, because yeah, this is really bulky and it may not even fit with one cap, but all I need, I don't want to use more than necessary, so this is sufficient. Once the hair is like that, then I touch on these sides and then I just slide it in like so. So that is the first one. And when the hair is like this, I feel a little bit safe, because nothing is coming off or falling off or dangling on my shoulders, and that means I am free to do my movement and work without the risk of having extra places to get chemo attaching, or microbes or pathogens attaching to my body parts. So that is it. So the next item I usually don is the mask, and it comes like this. So I open it, and this is after hand hygiene. And since you haven't seen me do hand hygiene, I should have started with hand hygiene, of course. So I had already done my hand hygiene before I start recording the video. So yes, I grab this by the earlobes and I just do that. Then I adjust the nasal part and mold it around my nose, and that mask is well fit. So to don my mask, then I grab it by these parts and I release it like so that it is like that, and I have the back part towards me. Then I open the arms, and voila, I do have my mask and my gown. I open the back very clear, and I don on that side without touching the front part on that side, and I am very well protected. So then usually you just turn this and put the vital together very well, and there my gown is almost done. So now that I have done my gown, I just fasten it like that, and I feel quite secure and protected, and my PPE is right on. So from here, the next thing I do, because this gown covers up to my wrist area, I go ahead and don my pair of gloves, and these are the gloves I'll be using for this demonstration. So I just open the gloves and then don the gloves appropriately, and they have to cover way above the gown. So I do the same for the other side. And voila! So now I feel safe. I have full closed shoes on my feet, and they are leather, and they are all round clothes, and they are very comfortable. They are flat shoes, and I can go to move around the area where I'm working at, and I feel safe enough to work with many patients and to handle different chemotherapy agents, and I feel protected. So my back feels like this, it is completely covered, and then my front view is like this. So now when it comes to doffing of my PPE, this is what I do first. I start with the gloves because this is what I have been using, and I have been donning and doffing gloves as I attend different patients. So yes, so I have to touch it by there and remove it like so, and place it on that hand. Then I touch on this side and remove the other one and form a ball like that. So then this is discardable, and remember this is the non-soiled aspect of the glove. This is the side of the glove that was on my body, so it's not the exposed part. So this one I can place it somewhere in a bin somewhere, and it's a bit safer than just removing haphazardly. So the next thing I want to doff off is my mask. I have just completed my procedure, and usually I will grab them by the earlobes, never touching the front, and then discard in the designated bin. If I am to doff off my gown, I would like to doff off my gown before doffing my cap. So again, the front part is considered contaminated and soiled because I have been working and my working space is in front of me. Therefore, I begin, since I do not have gloves, I cannot touch my front area because this is now soiled. This is contaminated surface. So anything in front and anything below the knee is contaminated. So I have to doff from behind. The behind is just clean because that is just my back. So I remove the velcro and then I unfasten my gown with the back straps I had fastened before. So I have undone the back part, and from there I remove it from grabbing it from the inside because I still do not have gloves. I have doffed off my gloves, remember. Then I slide it in front of me and fold it in a bowl, into a bowl or into something much more. Remember, this is the side that I was donning, this is the inside, so this is not as contaminated as the front. So I just fold it into a minimum size, and this is ready to be discarded in whatever bin according to the hospital policy that you should place this. And this is something that is already soiled, and I'm assuming it has patched areas with chemotherapy bits here and there. So I will discard this in the cytotoxic waste basket, because this is one use type of gown you use and discard. Next time you have to don another gown. So those are the simple steps. Once I have discarded this, so that one is discarded. The remaining piece that I need to remove is my hairnet, and I do not remove my hairnet until at the end of the very day, and this is just releasing, and again my hair can now flow back, and this we just discard like so. So yes, I have donned and I have doffed up, and I feel I haven't contaminated myself. Following this procedure of doffing, I again go and do my hand hygiene, and after completing this, I will do this off camera. Then I have cleared, I can do the rest of my activities and procedures as appropriately as I deem fit.